Speaker, and thank you to my honourable friend of Chipping and Barnet for raising her points. Since 2010, we've seen the government cutting health services and social care by £7 billion. Because of this, we MPs have been seeing local cuts in our individual constituency. Last week, a constituent of mine came to visit me during my surgery about a new policy that has come to effect. This policy states that patients will no longer be given prescriptions for over-the-counter medicines for a range of health conditions, even if they qualify for a free prescription. I would say a public health matter. There are 33 conditions which are part of this policy, from acute sore throat, excessive sweating, period pains to warts and verrucas. My constituent is 64 and has a number of health conditions which stops her from working. She's on universal credit, which gives her £317 per month, which is much less than what she would earn under the government's national minimum wage if she was working part-time. Because of her low income, she's had to use up all her savings and even pawn her jewellery that holds sentimental value to her to make ends meet. She recently went to a doctor's for a hay fever medication and was told that she was no longer entitled to free prescription. I feel a public health matter. When she disputed this claim, she was told that under the NHS England guidelines, they could no longer provide free prescription for mild to moderate hay fever. As a nurse of 40 years, I am dismayed of how poorly NHS England and the government publicised this consultation. Many people were unaware of this, and it just sums up what the government and its departments seems to do. Backdoor and underhanded changes. These have been the steps the government have been taking over the last 9 years to move towards privatising the NHS. It brings me to tears to see the changes the NHS England are bringing in, which affects the most vulnerable. Social economic deprived groups often face the prospects of a poorer access to healthcare and public health matter. We know that some of these conditions mentioned in the guidance are the first symptoms of a more serious conditions, and if diagnosed too late can cause long-term complications for the patient, a public health matter. Did NHS England take into consideration single parents and those on low income who are on universal credits? How are they going to afford to pay for medications for themselves and their children under this new policy? A public health matter. This isn't unfair to them. Having the right to free prescription was their safety net and one less problem to think about. Is this the part of the government's NHS 10-year-long plan to punish the most vulnerable individuals in society? The government needs to review this policy again. It is short-sighted and will have repercussions on their 10-year plan within the public health agenda.